and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle, and much more. Well, viewers, ear, nose, and throat, that is ENT problems, are extremely common in kids. So what could be the signs and symptoms of these and what precautions we can take? For that, we have with us in studio Dr. Deepanava Jyoti Das, ENT Consultant from Hayat Hospital. So not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. Right, thank you so much, Doctor, for coming to Good Life, the health show. So most common ENT problems in children. So many problems are there, and curious parents always ask a lot of questions to the doctor. So what would be the most common ENT problems in children?
First of all, thank you so much for inviting me. So regarding the ENT problems in pediatric age group, we'll start with the nose. Viral rhinitis or common cold is very common. Then bleeding from nose is very common during winters.
Okay.
If we come to ear, that ear infections like otitis media is very common. Also, sore throat or tonsillopharyngitis is also very common in pediatric age group.
Okay.
So these are common in those groups because of certain reasons.
Okay.
So we will talk about it one by one.
We will talk about those reasons. We have the first caller of the day, so let's take the call and then we'll proceed with the conversation. Hello.
Hello, my program to say so apnalokor more baby to work 4 বছর baby boy hoy eta problem to hoise ki মানে ঠান্ডা দিন কি এতিয়াও মোজা আছে যে একো নিপিন্ধে জোতা নিপিন্ধে আৰু ৰাতিও মানে গৰম পানী দিয়ে ঠান্ডা পানী খায় তাৰ এনেকুৱা ধৰণৰ হয় মাজে মাজে বিষবোৰ আৰু সেকেন্ড থিং আৰু এটা প্ৰবলেম হৈছে মানে আমি অটৰেক্স বুলি এটা হেৰি দিও কাণত কাণখন সাফা কৰিবৰ কাৰণে মানে ইয়াৰবাডটো হি লগাব নিদিয়ে মোক এই দুটা কথাৰ মানে সলিউশনটো লাগে
ওকে
সৰি মই আপোনাৰ প্ৰশ্নটো ভালকে প্ৰথম পাৰ্টটো শুনা নাপালো এবাৰ ৰিপিট কৰিব নেকি
প্ৰথম কথাটো হৈছে হি জোতা চেন্ডেল ঘৰত একো নিপিন্ধে এতিয়া মানে ঠাণ্ডা দিন তথাপিও পাছ কৰি থাকে আৰু মাজে মাজে কয় মানে ডিঙি বিষাইছে বুলি মাজে মাজে
ওকে সো প্ৰথম কথাটো হ'ল কি আপুনি যোনটো সেকেন্ড পাৰ্টত ক'লে ইয়াৰবাড লগোৱা তাতে আহো কি উই শুড নেভাৰ ইউজ এ ইয়াৰবাড ফাৰ্স্ট অফ অল
ওকে
ইয়াৰবাড এদি কেতিয়াও
আই এম ইউজিং অটৰেক্স একচুয়ালি
See, Otorex is a drop that is used for softening the wax.
Okay.
So let's come in two parts to your answer. First of all, let's talk about the ear problem, then the throat problem. See, Otorex is a drug that is used to soften the wax provided there is wax. Some amount of wax is always present in our ear, which is a protective value. So if there is not too much of wax build-up, there is no use of using the Otorex. And secondly, wax and other dirty things cleans by itself. We don't have to clean it by ourselves, it cleans by itself. Secondly, the throat pain, it can occur on and off because most of the time when we are exposed to cold, our oropharynx or the place where the tonsils and pharynx is there, they become congested on exposure to cold. So you may have some amount of pain, so that is nothing to be worried if we don't have fever or very painful swallow. So simple gargling with warm water is sufficient, and of course apuni je kole sandal nipinde moja nipinde hetu to apuniye solve koribo lagibo thik ase so keep the baby warm that is going to solve most of your problem
all right thank you okay please continue yes
No, actually, I just want to ask that Otorex যদি ইউজ নকৰো তেতিয়াহলে ইয়াৰবাডো কি ইউজ কৰিব নিদিয়ে এটো কি মানে নিজে এটো ক্লিন হৈ যায় বেবি ফৰ নে কিবা আকৌ ইয়াৰ ড্ৰপস I should use any ear drops
as I already told that there is some amount of wax in our ears that is having a protective value. So if there is not too much of wax build up and it is not causing any problem to your baby, we routinely do not give any drops, neither can we clean the ear with an earbud. So earbud is basically to get some relief from itching. It's not recommended for cleaning the wax.
Can understand. Thank you, doctor. Thank you so much for your
All right, thank you so much for calling. I'm sure you have asked your question and must be benefited with the answer what doctor has mentioned at this point in time. In the entire show, we will be continuing with the problems of ENT in children, and our numbers are flashed on your television screens, viewers. So if you have any queries regarding the ENT problems in children, please do call up. Dr. Deepanava Jyoti Das is in our studio and he will answer all your queries. Now, doctor, coming back to you again, common ENT problems, we have just got an idea about it. So let's start with ear first. Ear, then we will proceed with nose and throat again. So let's talk about the common ear problems in children and how to take forward.
See, common ear problems in children is otitis media. So it can be acute otitis media. It can be otitis media with effusion. It can be chronic otitis media.
Okay, otitis media is the medical term. So in general,
so yes, I'm coming to that. Generally what happens, otitis media means building up of fluid behind the ear because of an infection.
Okay.
So it can be acute onset, generally preceded by a viral infection of the nose or an upper respiratory system, after which it proceeds to the ear. So generally in acute otitis media, what happens, the middle part of the ear, we have three parts: outer ear, the part along with the eardrum, and behind is called the middle ear. So we have infection in that part. That infection will first lead to severe pain, fever, and at times it may rupture the membrane and the fluid may come out. So this is what we call acute otitis media. Most of the time acute otitis media is a self-limiting disease if it is limited to a viral infection. Generally it's a self-limiting disease of 3 to 4 days. The symptom will come, get a peak in 24 hours, then it subsides within the next 2 to 3 days. But if it doesn't subside, pain increases, fever is increasing, the child is most discomfort, I think then you should visit a doctor. Then bacterial infection might have set in.
All right, so the basic signs and symptoms would be fever, not feeling
earache,
earache,
fever. Those two are the most important thing, and the child will be very irritable. And these are very common in school going children because you know, they cannot absolutely maintain the hygiene. If someone is having rhinitis, children will play together and from one another the infection spreads. And from viral rhinitis, then you spread to otitis media.
Okay, so this is actually seen in the age group where the students, the children go to school and as they can't maintain their hygiene and also can't maintain those things because they'll play around with other children as well. So the infections can take it very easily. They can have those infections very easily. So at that point in time, the important role is being played by the parents there. So what do you say that at home, would they suggest their children that how they should be with the other children who are having infections, because at that time they don't think playing is a priority for them and nothing else?
See, it is very difficult to control it because what I would say in an average 4 to 5 episodes of rhinitis or otitis media generally happens in a school going child. Now what parents can do is after they come from school, at least make their hands wash properly. The parents will wash it and to maintain warmth to the child, that means give warm fluid, prevent from further exposure to cold, because if you are too much exposed to cold, then local immunity decreases, that can cause more inflammation. So to increases the local immunity, hot beverages, I mean in a child you will give hot, whatever hot you were giving, hot fluids, encourage to drink more water, keep the hands washed properly. Even the earlier signs of rhinitis should be dealt with whatever home remedies, or you may consult a doctor. So it's like preventing for spreading further and controlling the disease at the early stage.
Talking about the treatment part, doctor, what would be that if a child is being caught by this disease and he visits to any of the
if a person a child is having rhinitis or acute otitis media, first of all you should, I think for the next 2 days, first of all take a leave from school, don't send him school. Because he himself will get exposed to more viruses and he will also be providing viruses to the others. So give him rest. Give him, he should be drinking more fluids. Then common medicines can be used like paracetamol and decongestant to relieve his symptoms. Generally it improves within 48 hours. If he is not improving, problems are increasing, then I think you should visit a doctor.
If it's severe, then you should immediately visit a doctor.
A doctor.
Okay, so what is the first treatment procedure is being done? Is being provided with any drop, ear drop, or medicines is being given to that person or the child?
Again, it depends on the clinical scenario.
Okay.
In general, most of the time, since it's a viral infection, we generally do not prescribe
Okay.
antibiotics.
You ask them to take time or something
Yeah,
like that?
first of all, they come, we ask them what is the duration of illness. If they say the duration has been more than 7 days,
Okay.
our treatment is different. If the duration is 2 to 3 days, then again our treatment is different. In 2 to 3 days, generally we give supportive treatment, paracetamol for fever or pain and nasal drop for nasal decongestant, and we always encourage that keep the baby warm and encourage him to take enough of fluids.
Okay.
If the duration is more than 7 days, then we generally prescribe an antibiotic. That means it is not going to resolve by itself. Sometimes a patient may come with just a history of 2 days, but if he is having very high fever, very severe pain, then we may start the antibiotics from that point itself.
From day, okay.
So it depends on what the child is presenting with.
Okay, depends on the severity of the infection, like how it has
and
been
the
caused.
mode of presentation.
Okay, so antibiotics, when it comes to antibiotics, it also raises questions among the parents as well, because antibiotics, they think it's a bit harmful for the children when it comes to children or anyone. Antibiotics, they think that it might affect your kidney or something like that. So is that notion correct? Is that notion, because antibiotics will kill the germs, so that has to be provided by the hospital and the doctors as
See,
well.
the biggest problem of injudicious use of antibiotic is the resistance that is coming up against the antibiotics,
Okay.
rather than the side effects.
Okay.
Of course, if we use an antibiotic not in proper dose for a longer duration than required, then and repeatedly, definitely there are some amount of complication that can occur. But more what makes us concerned is injudicious use is, making the germs resistant to the antibiotics. So it should be always used judiciously and as per need,
Okay.
rather than injudiciously prescribing to each and every patient.
Absolutely. Okay. Let's talk about some other common infections of ear in children, doctor. Like this is one, rhinitis, and if there is any other infection related to ear in children, so.
See, first of all, let me just make one thing clear. Rhinitis is a problem with the nose that leads to ear problem. Leads to ear problem. See, in children, the most common thing is otitis media.
Okay.
There is one more entity, we call it otitis media with effusion, that generally starts with acute otitis media, in which the infection subsides, but the fluid that has accumulated in the middle ear doesn't clears up.
Okay.
So that leads to hearing problem. In some cases, the hearing loss is very mild, while in some cases, the hearing loss noise is moderately severe enough to hamper in school-going children, where they cannot hear properly, and that indirectly affect their studies.
Okay.
So hearing loss leading to difficulty in learning. In that cases, it should be treated accordingly, so that the problem
things will be more smooth. And just for. We have also heard about unblocked ears in children. So those unblocked ears, is it due to the high sound which they hear? Maybe some children, when they visit to the hilly areas, their ears get unblocked. So how to blocked and how to open that ears? Is it recommended every time to use ear drops, or is there any other process to do that?
See, first of all, what you have asked me regarding the ear block, that is about the blockage in the ventilating tube that causes the ear blockage.
Okay.
So the ventilating tube is present from behind the nose, it opens up behind the eardrum. So whenever we go to a hilly area, there is change in the atmospheric pressure that causes the ventilating tube to get blocked in some cases. So in that case, since there is no ventilation, the ear appears blocked. In that case, to open up the blockage, we need to put drops not by the ear but by the nose.
By the nose. Okay.
By the nose, so that it decongest the ventilating tube that opens in the behind the nose, so that the ventilation resumes. So that is the main.
So this has to be clear by everyone that it is due to the nose
that is creating the
so
ear
first
block.
of all, that drop has to be provided in your nose, not
the ear.
ears. Okay.
Because ear drop, if the tympanic membrane or the eardrum is intact, so what problem we are having behind the drum, drop from the ear cannot reach there.
Okay.
So it is not an infection most of the time, it's a mechanical blockage.
It's a mechanical block, okay.
So ear drop is not going to help much.
And that can happen to anyone, not only children, but anyone, any adult.
Even
okay.
adult.
Okay. Now talking about the cleaning part, which you were already mentioning to the caller as well, that they think that earbuds are meant for cleaning the ears, the dirty ears of children or maybe anyone. So is it a good, correct notion that the earbuds clear the ears, or something like the eardrops will loosen the ear wax and it will come out immediately, or will have. So what are the other things, like what is the notion that
First of
needs to
all,
be?
as I have already told you, that some amount of wax is normally produced by our ear canal, and
Okay.
it has a protective effect.
Okay.
It traps the dust and other environmental things that goes inside, mainly the dust. So,
Okay.
so the dust, and it cleans itself.
Okay.
It brings the dust and other things up to the orifice of the EAC, and then it falls away, or we can just clear it.
All right.
Now, earbud cannot be used for cleaning. A earbud is a rounded substance. So, if we want to try to clean it, it will push the wax further
Yeah,
inside.
it will push the wax inside.
Further
more.
inside.
Yeah.
So, actually, we don't have anything mentioned about earbuds in our books.
Okay.
But we can only say, if it is itching, we can just get some relief, by using
so
the
that
earbud.
notion has to be cleared by everyone there. Doctor will proceed with the conversation, but right now we'll have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on ENT problems in children. So, Doctor, coming back to you again, earlier to the break, we had a lot of discussion on the ear problems in children. So, let me ask you that what are the emergencies like faced in ENT? So, what could be that? There are a lot of emergencies being faced.
In pediatric age group, the most common emergency that we face is foreign body.
Foreign body.
Foreign body, the child, they used to insert maybe a plastic bead or a paper inside their nose or ears.
Okay. So that is called foreign body.
Foreign body. So,
Okay.
it's not a part of our own body that we put inside us. So, it may be a paper, it may be a part of a pencil.
If they are playing with some like small items, maybe
Yeah.
marbles or something like that.
Marbles will be a little bigger
little
one.
minute
but
ones.
like beads from the jewelries and all they used to put
Okay.
inside the nose and ears.
Unknowingly they might put
They
it.
put. Another thing is that foreign body in the air, foreign body throat. That means they sometimes, most of the time we get a child swallowing a coin. So it
That's
gets
a very common thing.
That gets stuck in our food pipe, mainly in the level of cricopharynx. That's a technical term, of course, and that comes with acute obstruction in the food pipe. So those are the foreign body. A very severe thing is foreign body in the airway. Most of the time we see during the festive season, they are playing with flutes and other that used to go inside. As they suck for blowing the thing, it goes
the
inside.
bubbles which they blow or something like that.
It is like what we call them small particles. It may be pin also. It may be something they
or those air guns which has those
pellets. So sometimes it can go into the airway. They are foreign body bronchus. So this is the most dangerous and severe form of foreign body. So foreign body in the ear. So it can be a vegetative material, maybe a food product, maybe a pea that's generally swells with moisture. Those needed to be urgently attended.
Okay.
Because they will swell up, cause infection. So that should be urgently dealt with. Sometimes you will find a piece of paper, and that actually I would not say a very emergency thing, but always should come and visit the doctor, which should be removed. Sometimes they insert even batteries inside the nose.
Okay.
So a battery is something that will be dealt with emergency because it will cause destruction to the surrounding tissue. Sometimes it can be a nut also they used to insert into the nose. So those things should be dealt immediately. So these are the emergencies that we get.
Okay.
And another emergency that we get in children is bleeding from nose.
Okay.
Even a drop or 2 drops of blood from the nose are very, patients get very apprehensive of what is happening with the child. Bleeding from nose is very common in children, especially in winter.
Okay.
So in winter, when we breathe in dry air, that causes the nasal skin or the mucosa to get some cracks, and it forms crust.
Because it becomes dry.
And when children used to pick that crust with their finger, they used to pick the nose, then bleeding occurs. It is most common from the anterior part. Very common. Actually, we shouldn't be worried too much. We should just pinch the nose and ask the child to breathe comfortably, through his mouth. Generally, we
without hurting them.
Just if we pinch the nose for 5 minutes, generally the bleeding stops in most of the cases.
Okay.
Whenever it's comfortable for you, you can always visit a doctor to rule out any other things are there or not. These things are more common If you are having allergic rhinitis, viral rhinitis, then these things are more common to occur.
More common. Okay, talking about the foreign bodies, that is a very important topic. We should at least discuss something about it, because those things are being done by children where their parents are not around them. So they do it unknowingly, of course. And do those reactions come immediately, or they might feel the pain or irritation after some time, and they might not able to explain them to their parents. So at that point in time, how important is the parents to come out about like what is wrong with my child? So how to make out that there is something problem with the children, or they should immediately take him or her to the doctor?
See, foreign bodies of the nose or ears, if the child doesn't say to the parents, they might come to know very late.
Very late.
Suppose a foreign body in the nose, a child might have inserted a piece of chalk or a piece of rubber. He has or she has not mentioned to his parents, then the parents will never know.
Never know.
Slowly and steadily it starts getting infected. Then the parents notice a foul smell from the nose.
Okay.
Sometimes bleeding from the nose. Then they bring the child to the doctor.
Okay.
And then on evaluation, either from history, then the child will remember telling that I have inserted something way back.
So will that create any problem in the treatment procedure, or will that
This
be able to treat it properly?
This generally doesn't cause any much severe problem, but as soon as we know, we should treat it.
Okay.
Because an infection in the ear, if it starts with a simple foreign body, get infected, otitis externa,
Okay.
then most of the time it will not cause much problem and it will be, treated accordingly. But there are rare cases where infection from the ear has spread to the neck.
Okay.
So these are very rare
Because
and
it's
rare.
all interrelated.
So it's a very rare and rare cases, but these have been reported in case studies. So as soon as we know, we should bring to the notice of the doctor and get that foreign body removed, and associated infections should be corrected.
Okay, so can block ears affect the speech also? Something is related to that?
Yes, very much related. When a child learns to speak, he must hear properly.
Hear
If he is
properly.
not hearing properly, he won't be able to repeat that sound with accuracy. So if I am not hearing properly, what I will hear will be a modification of what is actually been spoken to me.
Right.
I may hear a cat as a bat. So that's I will be learning.
I'll be repeating that.
So I'll be learning wrong. So for children who are beginning to learn the language, it is very important to have a normal hearing. Otherwise, his speech will always be defective.
Okay, okay. Now, we had a lot of discussions on ears. So let's move to nose now, Dr. ENT, because the nose, there are a lot of nose problems also, infections, that rhinitis we were talking about. And if it is more common in children, there are a lot of children, they are faced with a sinusitis as well. So let's talk about the nose allergies also among the children. What are the common ones if we need to talk on?
See, nowadays we are facing lots of patients with having allergic rhinitis.
Allergic rhinitis.
Allergic rhinitis is, it is a body's response to any allergen. It can be dust. Sometimes the nose reacts when the temperature is too cold. So allergic rhinitis is very common. See, there is no definite treatment for allergic rhinitis because it's our own body's response to a stimuli. So what we can do is prevent the child from that allergen. Prevent him from dust. Prevent him from
the things which he is allergic to.
Allergic to, that we have to be prevented. Now, if the allergies are not controlled, it helps in, it cause problems in our sinus drainage.
Okay.
Since sinus are very closely related to the nasal aperture, it hampers in sinus drainage, and it ultimately can lead to sinusitis. Sinusitis in pediatric age group was not seen too much before, but now we are seeing it.
Okay.
We are seeing it now. Lots of patients, lots of small child come with acute sinusitis. So we are seeing it now.
Okay, you are seeing it now. So this is, we can say that this is also one kind of very common disease which we see in children. And
not very common, but it is becoming commoner.
It's becoming common because nowadays we have seen that children, they talk about allergies, and parents, they talk about allergy, that my children is having a so-and-so allergic with this, or allergic with the dust, or allergic with some other, maybe winters, when winters arrive, they have a lot of problem. Maybe the clothes which they take out after a long time, when they wear it, they sneeze a lot. So those are some of the symptoms they can make out that your child is infected to some kind of allergy. So precautions has to be taken at that point in time.
First of all, if we are taking out something very long from the cupboard, we should generally wash it, dry it, and then use. Because
put it in the sun for a long time.
In woolen clothes, dust can easily accumulate.
Right.
So when you are keeping it for a long time, even fungal infection occurs. So you should, before wearing that cloth or using the cloth, if it is in the cupboard for a very long time, you should always first treat the cloth. That means wash it, dry it, and then let them use.
All right, doctor, we are really short of time. So on your last note, or what would you like to tell our viewers? Like we have to discuss more things about a throat as well. So if you need to sum up the entire episode, how would you do that?
Yeah, I would like to sum up saying that in ENT problem, the root cause is the nose. The nose is going to cause ear problem. The nose is going to cause some amount, much throat problem also. So I would say, and nose itself is very intolerant to dust and cold environment. Okay, so what my message will be, when the season comes, winter season or the dry season, always be your child well hydrated, give him lots of fruits so that he build up his immunity, and whenever you know that the child has started having problem or viral treatment, at least give him rest and start home remedies. I mean, keep himself warm, give him warm beverages or like warm things to take. That will prevent most of the cases from getting or worsening further. So with this, I would just like to conclude that maintaining warmth and hygiene is the two most important things that we should maintain.
And these are very common things which everyone can do at home as well. Alright, thank you so much, doctor, for coming to our show. And I'm sure the viewers who have watched our show must be benefited with this topic which we have discussed today in our episode. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.